welcome to the Better Space classes today. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Kachoa. I'm with PAR5 Physical Therapy here in Randolph, New Jersey, and I've partnered with them to bring you an easy and educational workday session. So today's session is going to be the movement checkup. We're going to talk about what exactly that is and what the results of this checkout will be. So hopefully it'll give you some insight on how flexible you are and where your possible movement deficits may lie. A little bit about me. I'm a doctor of physical therapy, got my doctorate from Mercy College in Ardsley, I guess Dobbs Ferry, New York, upstate New York, and BS in exercise physiology from Rutgers University. I'm an orthopedic clinical specialist and golf medical professional certified by the Titleist Performance Institute. So if you have any questions for me, feel free to unmute yourself or use the chat function to kind of chime in with some questions. So let me pull up my slides here and we're going to get started. So the big thing for today is that we're going to discuss this movement checkup. So one thing I haven't asked people to have this one requisite in prior classes, but today you'll get a lot more out of the class if you have a buddy with you to look at how you're moving or a mirror, and we'll talk about that because it's a lot easier for someone else to look at how you're moving or having a mirror so that we can determine whether or not you pass these tests. The one thing I will say is that flexibility, range of motion, how you move varies from day to day, depending upon what your environment is and what your stresses are. Did you work out today? Did you work out yesterday? Stuff like that. So this movement checkup can be like a daily assessment of how you feel and how prepared your body is to face the stresses of the day or your exercise routine. All right, so I'm going to pull this off, my lower third, and then we'll get into my little disclaimer. Again, this is not physical therapy. This is going to be some general information for the general population. If you're dealing with something specific, please reach out to me or consult another medical professional to have that specific problem addressed. Because even though we may find that if we Google something or look at a video to address a certain issue, without a physical exam, without a good assessment, it's tough to kind of find out exactly what your answer is to your particular individual problem is. So, if you're dealing with some pain or aches, make sure that you have that assessed. All right. So as we're going through this, make sure that you don't push through the pain. We're going to move slow and try and combine these postures and positions throughout your daily routine. So you're not trying to think about, I'm just going to set aside time to do this workout. Just make it part of your day. All right. So again, here's my little video of how the body functions. The body functions on this alternating pattern of stability and mobility. If this pattern is disrupted, then pain or injury is the result. So we want to make sure that every body segment, every body part is doing its job and not reversing its role. So stable segments should be stable and mobile segments should be mobile. A lot of times when we have a segment that should be mobile but is not, it tends to be more tight, and then the stable segments try to make up and become more mobile or unstable. We don't like that. All right, so the stuff that we're going to be talking about today is based on this functional movement screen, or more specifically the selective functional movement screen, but we're just going to take a 30,000-foot view on this assessment test that I do with all my clients that walk in the door, regardless of what their problem is. So if you come in and say, oh, my shoulder hurts, the pain is right here, or my back hurts and the pain is right there, I'm going to go through this total body diagnostic to figure out how or the root cause of that issue. All right? So the tests are going to be 7 things. We're going to look at your cervical, which is your neck. We're going to go into extension, which is taking your body and going backwards, extending the joints. And then number 3 is flexion. It's the opposite direction. How do you bend? And then 4 is rotation. We're going to look at 5, how does your upper extremity move? How does your arm move? And we're going to look at your squat. And then finally look at your balance. Okay? So now I'll give you a second. Get yourself set up. bring your computer, get it in front of a mirror or a buddy, and then let's get into it. So I'm going to transition into my two-shot here. Hopefully you've got me in this camera here, and we've got the side, and you could probably see over here I've got this full-length mirror that I could assess myself. But the first movement is going to be cervical. So what we do is we always want to standardize the test. So we're going to just start with both feet together. Okay. Once we have the feet together, then we're just going to check out rotation, cervical rotation. Arms are going to stay relaxed, and then you're going to turn your head as far as you can. Now, the big thing with this is that a lot of times I have somebody say, all right, let's see, can you turn your head? Inevitably, what will happen is that the shoulders and trunk will move. And like, yeah, I could turn my head. So body awareness is key, and that's why it's good to have either a mirror, so you could turn and see, all right, am I moving my shoulder, or am I just moving my neck? Or you have a buddy look at, check out how you're moving. So the passing grade is to be able to turn your head, the mouth closed, and your chin in line with the middle of your collarbone. So if you feel your collarbone, you just kind of find the middle section of that, and you should be able to turn even with that. My neck is super stiff today in the left hand, so I'm having a little discomfort turning to the left, and I can't quite get my chin to mid collarbone. All right, so that's a little tight, and I know I'm dealing with something like that, and I'm going to be seeing somebody this week to help have me take care of that. So we're going to also look at cervical extension. So mouth closed, I'm just going to keep the shoulders relaxed, chest relaxed, and we're just going to look up. And we're going to keep the mouth closed and as high as we can look up. And typically this is tight for me as well because we're always kind of looking down. The passing grade for this is to have the base of your face, the plane of your face, at least 10 degrees in line with parallel to the ground. So you want to get the face as close to horizontal as possible. And then flexion or moving forward is mouth closed. Can you bring your chin into your chest? And that's a little tight for me today, again, because I'm dealing with some left upper trap issues. So that's a cervical test. We have rotation, flexion, and extension. And then we can look at full body extension. I'm going to show you this from the side view. We're going to get your feet together, and then hands are going to be overhead. And we're going to look at where the arms go if we're totally looking at the side. So if I have my back straight, my hips underneath my trunk, I should physiologically be able to get my arms overhead so that they're by my ears, not like this. This is not overhead. If you see in the side camera here, the side view, my arms, as I come up, they're covering my face, they're not covering my ear. I want to be able to cover my ear and be able to see my face. All right, so that's full extension of the shoulder. And now we're going to look at global extension. Global extension is going to keep your feet flat, knees straight, and we're going to bring the hands back and then look up and bring your hips forward. So that might be tight on some people. So the points of passing or assessment here is that the front part of your pelvis should pass in front of your toe line. So I'm going to grab my little stick here to show you what that looks like. If I've got my feet together, I have this line coming up from my toe. There's the side view, and then my hips should be able to get past that line. The back line is going to be the heels, and as I bring my arms and head back, the shoulder blade, my shoulder blade should be able to pass that line. Okay, so that should be a uniform curvature of the spine to get into that extension. We shouldn't see like, bending the knees to try and get back or cheat like this, because then we lose hip extension. We're not getting that extension from the hip or the lumbar spine, we're getting it from the knee. So we want to make sure that we keep everything straight and really try and extend through the hip and the whole body to get into that position. All right, and then next is flexion, moving forward. So bending forward, knees straight, we should be able to have a uniform curvature of the spine, head, neck, shoulders, mid-back, lower back, and then hips, so that we should be able to touch the toes. All right, hamstrings might be a little bit tight. which is pretty common. And then typically I see people kind of break the knees to get down to this position. We want to try and keep that straight and then be able to round out the lower back completely and be able to touch the toes. So that's our flexion test. If you can't touch the toes, then we have to kind of piece that out and see exactly why. Is it just hamstring flexibility? And then we've got other positions to test that in to see exactly what the root cause of that tightness is. All right, and then we have rotation. So rotation, we start, let me see, I'll show you from the back view here. I've got my feet together. My arms are going to stay relaxed, and I'm going to rotate. I'm going to try and turn around as far as I can with my shoulders, head, neck, upper body, hips. So again, passing would be feet do not move, but I'm able to rotate all my segments above that, hips, pelvis, trunk, so that you could see my opposite shoulder, my right shoulder, a little tight in that rotation. And then I'm going to turn around the other way. And we see, all right, can you see my left shoulder as I rotate in this direction? So I rotate my hips to my right, rotate my trunk, rotate my head, shoulders, and then can you see my left shoulder? So a lot of times when we're rotating and I'm assessing that, people will tend to break their posture as they try and rotate. So they'll try and bend forward and then they're trying to get down like this, or they just kind of stop. So if you can't see that opposite shoulder in the other view, the back view, then that's a fail for that test. All right. Then upper extremity, your shoulder. We're just going to kind of, again, standardize our posture with feet together. We're just going to take one hand, keeping the head, neck straight. We're just going to raise up and then try and touch your other shoulder blade. Okay. So we're here touching your other shoulder blade. What we're looking for is, does the fingertips touch the top of your shoulder blade without hiking up that shoulder or without moving the neck and head? Okay. So this is my right shoulder. My head, neck can stay still. I'm touching. And then let's see the left, a little bit tight, and I have to bring my head forward to get my hand to my shoulder blade. So yeah, so I know that there's something going on in here, and we're going to address that. The next one is going to be reaching behind the back. So reaching behind the back, you should get the fingertips to be able to touch the tip of your other shoulder blade without walking it up. Okay, if you're walking it up, that's a fail. We just want to see, can I extend through the shoulder and bend the elbow and internally rotate the shoulder to sufficiently get it up to the shoulder blade. The other side, not so much. I'm tighter in that direction. I can get it up just to there. Doesn't touch my shoulder blade as much. But typically what I find with that test is that if that is your dominant side, it's usually about 80% of your non-dominant side. Okay, so that's like within normal limits. If you can't quite get there, but reaching behind the back is about 80% of the other side, then that's okay. All right, and then we're going to move into the squat. The squat is, sometimes difficult depending upon, because there's a lot of moving parts with this. But again, our standardization of this movement is going to be feet together. We're going to make the fists out in front. And then keeping the feet flat, we're going to squat as low as you can. So what we're looking for is bending the knees and bending the hips and rounding the back to get down to this position, keeping my feet flat with the hands out in front, balanced. And then can I get my hands, my fist to touch the ground outside of the feet? I don't want the hands to be out here or to be behind you. It's got to be within the frame of the feet. So that's the squat test. If we can't get into that position, then we can kind of open up and say, all right, can I put my hands out in front and maintain a position where I could squat hips below the knees and the feet flat with the hands out in front? Typically what I find, if we can't get into that position, then we just look at the ankles. So I just grab one of these. It's a half foam roll. And I'm going to put that in that position there, and I'm going to put my feet elevated heels, and the same standardized position that I started out with. I'll show you from the side a bit. Feet together, heels elevated now, hands out in front, make a fist, and then can I squat down here, and then kind of get my hands outside of the feet. this position here with the heels elevated is usually easier than the feet flat. So what that means is that we don't have a limitation with the hip range of motion or the knee range of motion. It's an issue with the ankle that limits people to get into a squatting position. All right, and then we need to stretch out the ankles. So that's a little bit of a breakout test to determine what the root cause of a squatting limitation is. And then balance is done barefoot, so I'm going to kick off the shoes. And then balance is just standing on one leg. Now, depending upon your age, what we're looking for is there's generally a norm for like maybe middle age, like let's say 30 to 40. We're looking for at least 30 seconds of being able to stand with the eyes open, and then we could test both legs with this. Typically, if we say like over 55, 60, 70, then we're looking for maybe about 15 to 10 seconds with the eyes open. And then we recheck if you can do that with the eyes closed. So we're going to lift the foot up, keeping your eyes open. And then when you feel steady, you're just going to close your eyes. And you're going to see, all right, how long can I hold that? We're looking for at least 10 to 15 seconds with that. All right, the foot is going to wiggle. The ankle is going to move to maintain your balance with the eyes closed posture. But what we're looking for is what happens. Does that foot move out of place? Like, do I hop? Do I have to wave my hands like this? And that's a fail. We want to try and be as still as possible with the balance and looking for 10 to 15 seconds of single leg stance with the eyes closed. All right? So that's our movement screen. That movement screen is basically a complete total body diagnostic that gives us an idea of what your movement limitations are. If you fail some of the tests, then what we do is we take that movement and try and change the parameters of that movement and see if we can attain the same shape. For example, let me go back to this. If we're missing, for example, being able to touch your toes, right? So if I can only get down to here, I have to see, all right, is that purely hamstring flexibility or is it a lumbar problem, right? A lower back problem. So then we get down onto the floor and then we assume the same shape. Feet together, knees straight, and I'm going to slide my hands forward, okay? And we see, what does that feel like, all right? If I can do this here and not do it in standing, this is the same shape. It's me bending forward, but I'm just sitting now. I've changed the parameters and requirements of my body to make this shape. Then it's not a hamstring flexibility problem if you're able to get to this position here. That is then a stability issue, like my balance, my strength of my hip, the strength of my trunk, holding myself up and expressing that full range, bending forward in standing, that's the problem. Now we address that separately. Another test for hamstring flexibility is to lie on your back, hands on the ground, keeping the leg straight and raising the leg directly to the ceiling. So with the leg straight and the other leg totally straight, this leg should pass, I'm going to try and show you this, a mid-thigh line. So if I have a stick and say, all right, where's the mid-thigh on my other side? This leg should be able to pass that. All right, so I'll show you on this side. Here's my mid-thigh. Hopefully that's totally straight. And then we're going to go up, and then we want that to pass. So that's another check of how flexible your hamstrings are. If they're not, then the root cause is a hamstring flexibility problem or a lumbar core stability issue that we can't get in standing. All right? So I hope that helped. I hope that was informational and helpful for you.